On the scale of 1 to 10, when I have acid reflux, the pressure is about an 8. It's this intense pressure that travels up my chest that can last from like 15 minutes up to an hour, 2 hours, and it's been pretty horrible.
That was Jacob. He's been struggling with severe acid reflux for the past 9 years. He's not alone. If you're one of the millions of Americans like him, you want to pay close attention to this next breakthrough.
Hey Jacob, how you doing?
Good.
Yeah, you're nervous for today?
Yes.
A little bit? We're going to be passing a tube with a light down into your stomach, and then I'm going to suction a little chip around the size of a bean into the esophagus. So there we are in the esophagus, and you can tell, see this area here in the esophagus? You see lines going up, so he's got esophagitis. So he definitely has reflux. Something is burning that esophagus. All right, that stomach is a little bit irritated. It should be nice and pink. All right, that's not normal. Okay, so now we're in the small intestine, and we're going to take some samples to make sure he doesn't have a bacteria. Open, close. That's what a biopsy is like. The patient doesn't feel that at all, because there are no nerve endings really on the inside of the stomach. And we're ready to insert the Bravo chip. If you notice, the Bravo chip is this little metallic thing right here. That's the dispenser. That's basically what shoots it out, dislodges it, and then it hooks into the patient's esophagus. So we're going to do this blindly, which means that we don't look at it through a scope. Swallow. Perfect. All right, so it's gone down. So now that it is safely in place, we take the safety cap off, we press down for 5 seconds, and then we dislodge. Done. There are the vocal cords. And there is the Bravo chip, right there in front of us. Perfect, that's beautiful placement. All right, so that little microchip is going to be transmitting pH information for the next 48 hours.
Jacob is here with his gastroenterologist, Dr. Jorge Rodriguez. Welcome to you both.
Thank you. Thank you.
Thanks for sharing your esophagus with all of us. Well, this is really fun technology because this Bravo chip gives you a look in real time what's going on with the acidity basically in your lower esophagus.
Yeah, it's amazing technology. We like to call it the Hubble of inner space, you know, in GI, because you can sort of see for 2 days what's going on in there, what his pH is.
And pH is a measure of the acidity for
Exactly.
people who don't know that at home.
Exactly. The stomach makes acid, and the pH of the esophagus should be only around 6. So when acid abnormally comes up to the esophagus, it's not supposed to be there, so it obviously burns the esophagus. Here we have our little reproduction of a stomach, and the stomach has contents. Some people, here we go, have a little bit of reflux. Some people have it all the way up. The problem is that it can come so far up that it can burn your throat. For some people, it can go into your lungs. It can cause asthma, coughing, and poor Jacob, I mean, he had it all the time, really all the time.
So this was in his esophagus. What were his results like?
The first graph on top is what a normal pH monitor is. So you see that it doesn't vary very much. The bottom one has all those spikes. I've never seen this many spikes. Jacob in 48 hours had 172 bouts of reflux. I mean, significant reflux. And what was odd about it is that he had the majority of them while he was standing up. Most people have it while they're lying down. So he really has a big issue. And, you know, so now I believe everything
Which is
you told me.
so unusual with someone in his body frame, thin, active, healthy.
Yeah.
We know that he's got reflux. What are his options now?
Well, his options are, since he is not responding to treatment, I mean, he's been on every medication, and even on the medications, the acid still comes up. You may need some surgical intervention. He may need some other tests that are actually going to perhaps tighten this area here where the stomach meets the esophagus so that it doesn't reflux all the way up. So that chip gave us a lot of information.
And what about people at home who occasionally suffer from heartburn? What steps can they take to prevent it?
Well, the first thing that people at home need to do is they probably need to modify their diet and lose weight. I mean, being heavy causes a lot of intra-abdominal girth, which causes the pressure in the stomach to increase. So things are more common to reflux. And then fatty foods, foods that are acidic, foods that have a lot of spice, those cause a lot of reflux. Some of them just open up that sphincter to the point where you're walking along. Coffee's notorious for that.
Coffee, alcohol.
Yeah, alcohol.
Now, are you guilty of any of these foods?
No, I eat healthy.
No, really, he's the anomaly.
So he really is the anomaly.
Yeah.
So for you, there's nothing you can really do other than maybe a surgical intervention, but most people at home can really prevent these symptoms. But when should someone at home worry about this?
Well,
and go seek professional attention?
Like one of the rules in medicine, if something doesn't go away after a while, you should see a doctor. So there are a lot of over-the-counter medications. You should try those every once in a while. If your symptoms don't go away with that, you need to see a doctor. Worsening symptoms are if food starts getting stuck in your esophagus, then there's a problem. There could be scarring. Worse yet, there could be esophageal cancer. If food starts hurting as it goes down, go see a doctor.
A lot of people don't know that if you have reflux for years and years, the cells of your esophagus will start to change.
Exactly.
And can become cancerous, which is why it's so important to control your symptoms. And if over-the-counter doesn't work, there are other options. Jacob, thank you so much.
Thank you.
And Dr. Rodriguez, we appreciate you being here.
My pleasure.